Hello everybody. Today I'm going to talk to you guys about a condition called vestibular neuritis, and I'm going to explain you what that is and what's causing the condition and what's happening in your body when you get vestibular neuritis. And I'm going to show you 5 of my favorite exercises that I recommend to people with vestibular neuritis. My name is Harry Panikar and I'm a physical therapist. Welcome to my channel High Performance. So coming to vestibular neuritis, we have a system in our inner ear called vestibular system that basically controls the balance and also detect the head movements and send signals to the brain about these head movements. And we have a nerve called vestibular cochlear nerve in the inner ear that connects this vestibular system from the inner ear all the way to the brain, and it sends signals from the inner ear to the brain. So what happens with vestibular neuritis is, like, when you get a condition, these nerves can get inflamed, and then that signals that go from the inner ear to the brain get disrupted, and then you get the symptoms related to that. I would come to the symptoms. Now, before going to that, I would tell you what is causing vestibular neuritis. Most of the time, vestibular neuritis is coming from a viral infection that's happening, like sometimes it's happening to the nerve itself, or sometimes when you get viral infections like a flu or like a chicken pox or any kind of viral infection, that can come to the inner ear and that can cause inflammation to the vestibular nerve, vestibular cochlear nerve, and then you can get the symptoms related to vestibular neuritis. And the common symptoms are like out of a blue, you would be feeling like a spinning feeling or quick spinning feeling, which is called vertigo, and then you would be associated to that. You would be having like dizziness. Sometimes people would be having balance problems, disequilibrium, nausea, vomiting, all these issues. So these are the symptoms related to the vestibular neuritis. I'm going to show you the first exercise, which we call like a gaze stabilization exercise. So your gaze stabilization basically comes from your inner ear, especially when you turn your head, your gaze will be stabilized through the inner ear vestibular system. So I'm going to show you an exercise to work with that part actually. So what I want you to do, I want you to look at a target and then slowly turn your head side to side. So what you would be doing is, like, you can just look at the tip of your thumb, the nail part. Then I want you to look at that, keep it like stretch your arm out like that, and look at the tip of that thumb over the nail region. Then I want you to slowly turn the head a 30-degree to the right side, then a 30-degree to the left side. Sometimes when you use glasses, like, the frame can block the vision, and if you think you can really see things within that reach, I would say, like, you can take off the glasses and you can do that. I would take off my glasses and I would show you that. So you'll be looking at the tip of that thumb again, and then you're going to say, turn your head 30-degree to the right and 30-degree to the left. So it will be like this. And once you get that movement, I want you to keep going. So the speed is basically determined, like, basically it's your how clear you can see this. If you're not seeing this clearly, I would say go slowly. Now let me tell you a common mistake that usually people do when they do this exercise, this gaze stabilization exercise. People try to do that, like, look at the tip of that, then they try to move that thumb side to side and look at that. That's not what we are looking for. We are looking for stabilizing at a target, and we are looking for turning that head. We're not looking for eye exercise from side to side. So that's something I want you to keep in your mind. So if you think it's too much for you, you can put like a target on the wall and stand in front of that, and then slowly try to turn your head side to side. Now I'm going to show you the second exercise, which is a vestibular stimulation exercise, and it also can be used as a balance exercise. And I want you to do this in standing actually, and there are various progressions in standing too, but in the beginning I would say, like, stand with like a shoulder width apart, like your feet would be like that width, and then in the beginning it would be good to go to a corner or close to a wall and do that, or if you have really problems with balance, I would recommend you to have some supervision with that. So what you're going to do, I want you to keep your arms across your chest, then stand with the shoulder width, and then try to keep your eyes closed, then slowly try to turn your head to one side, then go to the opposite side. Sometimes when people do that, they feel like really, like, swaying side to side. So if that is the case, I would say we can do that in open eyes. So you'd be like keeping your eyes open, then go side to side like that. Then I want you to go like that 10 times and see how that's going for you. If you think like, your balance is cute, you don't get any symptoms and you don't feel any swaying. So at that time, I would say, then try to close that eyes and see how you're reacting to that. So if you're closing your eyes, and maybe slowly turning side to side. So this one, again, you can do it like, 3 to 4 times in the beginning and then slowly try to progress like 5 to 7 times. So go with a small number like a 10 or something in the beginning and slowly try to progress to 10 to 15 times. Or you can even count for some time like 30 seconds or 1 minute and go like that. I'm going to show you the third exercise. This is some sort of variation of the first exercise that we've seen. So this one, if you think it's really symptomatic for you, you can do it sitting down. And if you think it's really you don't feel anything when you're sitting down, then try to progress it by standing actually. So again, like you don't need any special equipment for this. What I want you to do is like I want you to stretch your arm outside and look at the tip of that thumb. Then I want you to turn your body 90 degree to the right side, then 90 degree to the left side. So it's like a 180 degree, and all the time I want you to look at the tip of the thumb. So you would be feeling like your background would be moving really side to side, but your target, like you would be focused right over here. So this is like sometimes people feel really symptomatic, especially if you have a lot of movements happening in the background. If the background is plain, sometimes people feel better, but if the background is like a television or something going on, or a road with movements going on there, so that time people can feel symptomatic. So I would recommend to do or begin by with a plain background, then go like in that 180 degree side. So I'm going to show you that one more time. So if you're looking at the tip of that thumb, you're coming to right, then go to the left. No stop in the middle, all the way like that. So like this. And I would say in the beginning, you can do it for like a 10 times, or even if sometimes for some people it can be too much. So go like 5 times and see how you're reacting to that. Now I'm going to show you the fourth exercise, which is called walk with head turn. This is a really great exercise, but it's also an exercise that can provoke the symptoms really a lot. So this exercise requires some sort of supervision in the beginning, especially for someone who is having a lot of symptoms and balance issues actually. So imagine like in a situation like, or think about it, if you're having symptoms like when you go to outside, or like when you go to a grocery store and walk around and turn your head. When you walk around and turn your head, if that is the time you're getting symptoms, this kind of exercise can be beneficial for that individual actually. So it's very simple. What I want you to do is like get into a hallway or get into a big room where you can walk back and forth, and then simply walk and then turn your head side to side. So you'll be walking and turning the head side to side. Sometimes people think that they have to walk like heel to toe pattern. You don't need to do that. You can just walk like the way you regularly walk, and then slowly turn the head side to side. Make sure like this is not like you're turning the head like quickly side to side and trying to walk. That can really throw the balance or make you feel sick. So this is like just normal walk and try to turn the head slowly side to side. And this one, it can push the symptoms. So make sure like this exercise are within that like a mild push range of your symptoms from the baseline, and relax and make sure like you're feeling good. And then when you're okay, then progress to the next step. I would recommend it in the beginning for like a 30 seconds to 1 minute walking, relax, and do that again. 3 to 5 times per day would be really good to begin with. Now I'm going to show you the fifth exercise, which is basically like an eye movement followed by a head movement actually. The beginning, like when you start doing this exercise, you can do it in sitting, and when you think you have progressed, listen to your body, and then you can come to a standing position and progress the exercise. Quite simple exercise. What I want you to do, stretch your both arms outside, a bit inner side to the shoulder, and then you get two targets. So I mean like it's your thumb, and then I want you to look at the left side and turn your head to the left. Then look at the right side, turn your head to the right. Look at the left, turn your head. Look at the right, turn to the right. So it's basically looking at a point, then turning your head there, then looking to the other one, turning your head to that. So this is the way you do that. And in the beginning, I would tell you, go with it 10 times each side. When you think you have progressed, you can do it like increase the speed of that movement, and then also like increase the repetition actually. It's good to start with sitting and then slowly progress to a standing position. So these are the 5 of the favorite exercises that I recommend to people who come to me with vestibular neuritis. And everybody is different, every individual is different. And listen to your body and feel your symptoms, and then do the exercises. Pick one and see how that's going for you. And if you think it's going good, then slowly progress and pick the next one and progress like that. I hope this would help you with your symptoms, and good luck with that. Thank you for watching my channel, and thank you for watching the video. If you have any questions about this condition, you can post that in the comment. If you really like the video, you can like the video, and then share it with your friends and family who is having the problems like that. And if you want to see more videos like this, you can subscribe to my channel and put that notification button on so you would get the update about the new videos.